Hello, everyone. This month's TeachHUB podcast topic is a little more serious than some of the other things we've discussed recently. Often we discuss teaching tools or strategies, but we want to take some time now and address how eating disorders may be present in your classroom and what you should do in these circumstances. We have to acknowledge our advantage and responsibility in the fact that we see our students every day, sometimes more than their parents do. We might be the first to recognize if a student is struggling with an eating disorder. First, it's important to understand that eating disorders can happen to anyone, anywhere, though they most commonly appear in white upper-class females ages 13 to 30. Unfortunately, youths frequently feel ashamed of their behavior and are unlikely to seek the aid of a parent, teacher, or mentor. This makes it more important for us to be able to identify the signs and know what course of action to take. As an educator, you are on the front lines of helping identify the signs of a potential eating disorder in a student. Learn to identify the signs that you're most likely to encounter in your classroom. The appearance of a student may change. She might become thinner, weaker, and paler. She may demonstrate rapid mood changes as well, usually expressing a negative, angry, or depressed emotion unexpectedly. Insecurity often accompanies eating disorders, as she might feel inferior to those around her or to her own idealistic expectations of herself. Also, listen to how she talks. You might hear a prevalence of comments related to food, dieting, appearance, or excessive exercise. Listen to her friends. You may overhear or they may tell you directly that something is wrong. If you notice any of these signs, it is probably an indication of some underlying problem and you must take action. First, determine if the situation is life-threatening. If it is, you need to contact a qualified professional like the student's counselor or school psychologist immediately. You can talk to the student, but avoid asking things like, "Do you think you have an eating disorder?" or saying, "You look like you might have anorexia." Especially avoid telling a student simply to stop their disordered behavior. If they could, they would. Instead, tell the student what you have noticed and ask if everything is okay. For example, you might say, "I noticed you've been more tired and irritable in class than before. Is anything the matter you'd like to talk about?" Even if the student ignores you or claims everything is okay, they know you care. Finally, don't feel like you have to do it alone. You're a teacher, not a trained therapist, counselor, psychologist, or nutritionist. It often takes a team of trained and experienced professionals to help resolve a student's eating disorder. Don't feel like you need to be responsible for making a plan, rehabilitating the student, or resolving their issue. All you need to do is listen and refer the situation to professionals who can take more detailed care of the student. Counselors don't get to see their students every day, so they often rely on teachers to alert them to signs of potential problems. If all you do is notice the signs, listen to the student, alert another professional, and remain supportive, you've done enough. So as you go through your school year focusing on the academics of your classroom, don't overlook the emotional and physical well-being of your students. You might just save a life.